Good afternoon, everyone. Here is Dr. Imran from Pakistan. Today we talk about tooth pain related issues. First, I want to talk about tooth pain types. Sharp and sudden pain. This type of pain often suddenly and sharply indicating possible nerve sensitivity or dental trauma. Dull itch. A dull itch may suggest underlying tooth decay in infection or gum disease. It can range from mild discomfort to throbbing pain. Throbbing pain. Throbbing pain usually indicates an infection or abscess in the tooth or gum. It can be accompanied by swelling and tenderness. Pain with pressure. Tooth pain by pressure such as chewing or biting may indicate a cracked tooth cavity or damage to dental filling. Pain with temperature changes. Sensitivity to hot or cold temperatures can indicate enamel exposed tension or nerve irritation. Radiation pain. Pain that radiates to other areas of the face, jaw, or head may suggest a more severe dental issues such as an abscess or impacted tooth. Pain triggered by sweet or sour foods. Tooth pain triggered by sweet or sour foods may indicate tooth decay or a cavity. Tooth pain causes dental decay. Cavities, the most common cause of the tooth pain is dental, also known as cavities or caries decay. When bacteria in the mouth produce acid that the enamel, leading to the formation of small holes or cavities in the tooth surface. Gum disease such as can cause tooth pain when bacterial infection lead to inflammation and damage to the gums or supporting structure of the tooth. In advanced stages, gum disease can result in tooth loss, tooth fracture or cracks, trauma or injury to the tooth such as from biting down on hard objects or substaining or below to the face can cause fractures or crack in the tooth. Structure these fractures can export to sensitivity inner layers of the tooth, leading to pain and sensitivity. Dental abscesses. A dental abscess is a pocket of pus that forms within the tooth or in the surrounding issues due to bacterial infection. Abscesses can cause severe throbbing, tooth pain, swelling, and fever, and may require prominent treatment to prevent further complications. Tooth gratings. Chronic teeth gratings or clenching non can cause tooth pain and sensitivity by wearing down the enamel and exposing the underlying dentions. after during sleep and may be associated with stress or anxiety. Dental procedures. Certain dental procedures, such as filling root canals or tooth, can cause temporary tooth pain. Temporary tooth pain or sensitivity as the teeth and surrounding tissues heal. This discomfort typically subside within a few days to a week after the procedure. Dental misalignment teeth or bite problems such as overcrawling, crowding can place uneven pressure on the teeth, leading to pain, discomfort, and increased risk of dental issues such as decay and gum disease. Tooth sensitivity characterized by pain or discomfort when consuming hot, cold, sweet, or acidic foods and beverage and result from enamel gum resections or exposed tooth rods. Other medical conditions, symptoms, health conditions such as medications, some medications such as antidepressive medicines, antihistamine medicines can cause dry mouth as a side effect, increasing the risk of dental decay, gum disease, and tooth pain. Genetic factors, and family history of dental issues such as susceptibility to dental decay, gum disease can influence our individual risk of experience tooth pain and oral health problems. Now I want to share tooth pain symptoms. Number one, sharp or throbbing pain. Tooth pain often as a sharp stabbing sensation or a dull throbbing itch localized to sharp pain after present as a sharp stabbing sensation or a dull throbbing itch localized to the affected tooth or area of the mouth. Sensitivity to temperature, increased sensitivity to hot or cold foods and beverages common symptoms. With pain, consuming hot soap or cold ice cream may indicate underlying dental issues. Number three, pain with pressure. Tooth pain may worsen after biting down or applying pressure to the affected tooth. This can be indicate of various dental problems including cavities, cracks and abscesses, swelling or redness. Inflammation of the gums or the surrounding tissues may accompany tooth pain, swelling, and redness around the affected tooth or in the gum can indicate infection or other underlying issues. Number five, bleeding gums. Tooth pain accompanied by bleeding gums, especially during brushing or flossing, may suggest gum disease or other dental condition requiring attention. Number six, bad breath or foul taste. Bad breath or a foul taste in the mouth near the affected tooth can be symptomatic of tooth decay, infection, or abscesses formation. Difficulty chewing or biting. Tooth pain may interfere with chewing or biting, making it uncomfortable or even painful to eat certain foods. This difficulty can result from dental decay, cracks, or other structural issues affecting the tooth. Radiating pain. Radiating pain, number eight, radiating pain. Pain from a disease or damaged tooth may radiate to other areas of the head and face, such as the jaw, ear, or temple. This refer pain can vary to intensity and may worsen with movement or pressure. Pus pain disrespect, sleep, comfort, and restlessness, especially when laying down. Difficulty sleeping due to tooth pain may be a sign of a more serious dental issues that needs attention. So now I want to share risk factors for tooth pain. Number one, poor oral hygiene. Indicate our oral hygiene parasites such as brushing, flossing, and regular dental checkups increase the risk of dental decay, gum disease, and other oral health issues that can lead to tooth pain. Number two, dietary habits. Dietary habits, consuming a diet high in sugars, carbohydrates, and acidic foods and beverages can contribute to dental decay. Cold drinks contribute to dental decay and of the dental enamel, increasing the likelihood of the tooth pain and sensitivity. Tobacco use. Number three, tobacco use. Smoking and using smokeless tobacco products can compromise and health by promoting gum disease, tooth decay, and delayed wound healing, raising the risk of tooth pain and other dental complications. Number four, alcohol consumptions. Excessive alcohol consumptions can dehydrate the mouth, reducing saliva, producing and increasing the risk of dental decay, gum disease, and oral infection that may cause tooth pain. Number five, dental trauma. Engaging in cavities that increase the risk of dental trauma, such as contact sports or accidents, can result in fractures, cracks, or injuries that lead to acute or chronic tooth pain. Number six, age. Advancing age is associated with an increased risk of dental issues such as gum resections, tooth wear, and oral infection, which can contribute to tooth pain and discomfort. Number seven, dental anxiety. Fear of anxiety about visiting the dentist may deter individuals from seeking timely dental care, allowing dental problems to progress and potentially cause tooth pain and other complications. Now I want to talk diagnosis of tooth pain, dental examination, comprehensive dental examination by a dentist for diagnosing the underlying cause of tooth pain. The dentist will visually inspect the teeth and gums looking for signs of decay, damage, or infections. Number two, x-rays. Dental x-rays provide detailed images of the teeth, roots, and surrounding bone structures, allowing dentists to identify issues such as cavities, abscesses, fractures, and impacted teeth that may be contributing to teeth pain. Number three, pulp testing. Pulp testing involves assessing the health of the tooth pulps, which contains nerves and blood vessels. Tests such as cold sensitivity test, heat test, and electric pulp testing help determine if the pulp is inflamed or damaged. Number four, percussion testing. Percussion testing involves taping on the teeth with the dental instrument to involve sensitivity and pain response, which can also identify issues such as cracked tooth or inflammation of the surrounding issues. Number five, Number five, periodontal examination. A periodontal examination assesses the health of the gums and supporting structures around the teeth. Dentist checks for sign of gum disease, gum resections, and periodontal abscesses that may be causing or contributing to the tooth pain. So number six, different diagnoses. Dentists use a process of elimination to rule out other potential cause of the tooth pain such as sinus infections, joint TMJ disorders, or referred pain from neighboring teeth or structures. Now I want to share some allopathic and some homeopathic remedies for tooth pain management. So first, warm salt water rising the mouth with warm and salt water can help reduce inflammation, cleanse the mouth, and alleviate tooth pain. Mix a teaspoon of salt in a glass of warm water and swish it around the mouth for 30 seconds before spitting it out. Number four, Number two, cold compress. Applying a cold compress or ice pack to the outside of the cheek near the painful tooth can help numb the area and reduce swelling, providing temporary relief from tooth pain. Warm the ice pack in a cloth and apply it to the affected area for 15 to 20 minutes at the time. Number three, avoiding triggers foods and drinks. Avoiding foods and drinks that are hot, cold, surgery, or sugary or acidic can help prevent further irritation and discomfort in sensitivity or painful teeth. Stick to soft foods and lukewarm liquid until the tooth pain subsides. Number, Number four, gentle brushing and flossing. Maintaining good oral hygiene, parasites, including gentle brushing and flossing, can help prevent rosin of tooth pain and alleviate discomfort associated with dental issues such as cavities, gum disease, or dental abscesses. Clove oil contain a natural and antiseptic compound that can help numb the nerve and reduce tooth pain. Apply a small amount of clove oil to a cotton ball and dab it into the painful tooth and gums. Herbal teas, certain herbal teas such as chamomile and peppermint tea may have soothing properties that can help alleviate tooth pain and promote a relaxant. Sip on the warm herbal tea throughout the day for relief. Now I want to share some homeopathic. remedies which we are common use in our clinical practice. First remedy is Hepersulf. Root abscesses responds positive to the Hepersulf. For fever occupied by chills due to severe toothache, Hepersulf is considered to the perfect remedy and tend to decrease the level of swelling and pain on the hand if your face swells and there is an incidence of gum inflammation. So we are use Hepersulfin 30C and Hepersulfin 200C according to the patient condition. Next remedy which we are common use Plantigo. Plantigo is noted to the most common remedy toothache and for treating sensitivity the pain extending to the ear from the tooth receives maximum relief due to the effects of Plantigo. It might have to taken internally or applied externally depending on the severity of the toothache and its occupied conditions. So we are use Plantigo in only in mother tincture, only in Q or mother tincture. Next remedy is Staphysagria. Staphysagria sensitivity is best taken care of remedy. Staphysagria resolves the problem of rousing of toothache when any drink or food is consumed, bleeding gums, and excessive salivation is also another aspect that is looked after by Staphysagria. So we are used Staphysagria in 30C, Staphysagria in 200C according to the patient condition. Next remedy is Arnica. Tooth and filling may often lead to the consequences of nerve wracking pain in the gum and the affected area for this. The homeopathic remedy is arnica to assuage the nerve pain and most by the taken along. So we are use arnica in 30C and arnica in 200C according to the patient condition. So next remedy is Merxol. Merxol excessive salivation that tend to stimulate with toothache can be solved by a dosage of homeopathic remedy. Merxol, bleeding gum, looseness of teeth, and sensitivity are all taken care of by the same remedy. So we are use Merxol in 30C, Merxol in 200C, Merxol in 1 m according to the patient condition. Next remedy is Hecla lava. Hecla lava for jaw swells along with toothache. You must always use this remedy. Hecla lava, this for tooth pain, its effect and relieved by swelling and pain. So we are use Heclava in 30C, Heclalava in 200C according to the patient condition. Next remedy is Chamomilla. Chamomilla swear as the best remedy for easing heat sensitivity that is likely to worsen the exhausting toothache, drinks, and food, either hot or cold, can then be consumed easily because of the numbing effect of this remedy. So we are use chamomilla in 6C, chamomilla in 30C, chamomilla in 12C, chamomilla in 30C, and chamomilla in 200C according to the patient condition. So next I want to talk about next remedy is Coffea croda. One of the best remedy for toothache better by cold water. When the pain is better by holding cold water in the mouth, coffee is one of the best remedy for toothache. The pain increase after taking hot food. The pain is even aggravated by any external warmth. The medicine is made from unroasted coffee. It is often indicated in people who are habitual coffee drinkers. There is an increased sensitivity and restlessness is also marked. The odd or unusual thing about this remedy is the pain is indicated by positive emotions like sudden happiness, joy, or any excitement. So we are use Coffea croda in 30C, Coffea croda in 200C, and Coffea croda in 1 m according to the patient condition. Next remedy is sepia. Sepia, one of the best remedy for toothache aggravated by sweets. When the pain in the teeth is triggered by eating anything sweet, sepia is one of the best homeopathic remedy for toothache. The pain may extend to the ears. It gets rose by biting teeth together. The pain is also rose while laying. At times, the pain increases in the evening around 6 p.m. and remains so till midnight. In females, the pain is aggravated during menses. The gums are dark red in color. The gums are swollen and blood oozes from the gums. The teeth are curious and bleed easily. So we are use sepia in 30C, sepia in 200C, and sepia in 1 m according to the patient condition. Next, I want to talk a very important remedy, creosote, one of the best remedy for toothache extending to the temples. When the pain extends from the tooth to the temples, creosote is one of the best remedy for toothache. The teeth are usually dark in color and decayed. The patient is restless and wants to the constantly in motion. He is unable to sleep because of the pain and keeps shrieking all night. Gums are spongy and uncleared. They bleed easily. There is a putrid smells from the mouth. The taste remains like a bitter. So we are used creosote in 30C, creosote in 200C, and creosote in 1 m according to the patient condition. Next remedy is Mazarium. Mazarium, one of the best remedy for toothache in curious teeth. When the pain is in curious teeth, Mazarium is one of the best homeopathic remedy for toothache. The teeth usually decay at the roots. The pain is increased by tooth and by movement of any kind. The toothache, even when it come it content with the tongue. The pain extend to the cheekbones. The pain may be described by some patient as of the teeth are being pulled out. So we are use Mazarium in 30C, Mazarium in 200C, and Mazarium in 1 m according to the patient condition. So next, I want to share some single remedies which we are common use in our clinical practice. So first, arnica alleviating pain and swelling after dental procedure, hypericum shooting nerve pain along dental pathways, chamomilla easing intolerable toothache with hypersensitivity, coffea relieving tooth pain aggravated by heat, belladonna mitigating sudden intense tooth pain, Merksal alleviating painful gums and bleeding, Plantigor elevating toothache with sensitivity. Staphysagria addressing toothache with tenderness. Nux elevating irritable tooth pain. Calendula promoting healing and infection control. Arnica is renovated for efficacy in reducing pain, bruising, and swelling associated with dental trauma or surgical interference. It is seen as a go-to remedy for post-operative discomfort, helping patients recover more comfortably. Key symptoms: pain, bruising, and swelling after dental procedure, bruising and swelling following trauma of bleeding gums and tissues after dental, discoloration of the teeth due to injury. Hypericum shooting nerve pain along dental pathways. Hypericum is a vital remedy for tooth pain characterized by sharp shooting nerve pain. It is particularly effective in alleviating discomfort along the nerve pathways, providing a relief from dental procedures or injuries. Sharp shooting pains along the dental nerves, pain following dental work such as drilling or relief from warm application and warm drinks. Relief from warm application and warm drinks, pain radiating to the jaw, face, and temples. Chamomilla, intolerable toothache with hypersensitivity. Chamomilla is invaluable for individual hypersensitivity to dental pain where conventional remedies, pain medications offer little relief. It addresses acute toothache occupied by hygiene sensitivity, providing a more balanced nerve response. Key symptoms: intolerable toothache, especially at night, hypersensitivity to pain, making dental work disturbing, pain radiating to the ears or causing swollen cheeks, aggravation from heat and temporary relief from cold. Cophia, a relieving tooth pain aggravated by heat. Overview: cophia is affected in managing toothache by heat, offering a relief from the intense, unbearable pain. It is indicated when the pain roses with hot drinks and is often experienced as shooting or tearing sensations. Key symptoms: toothache identified by heat such as hot drinks, shooting, or tearing, pain in the affected tooth, aggravation at night, disturbing sleep, temporary relief from cold application, belladonna, sudden intense tooth pain, Merxol alternating painful gum and bleedings. Merxol is a significant remedy for tooth pain associated with tender bleeding gums and loose teeth. It addresses oral discomfort by offensive breath and excessive salivation, offering a relief from the disturbing symptoms. Key symptoms: tender bleeding gums, loose teeth and tooth decay, offensive breath, and excessive salivations. Belladonna is a valuable remedy for sudden tooth pain that come and gum goes suddenly, it addresses toothache and occupied by tenderness and sensitivity to tooth, providing relief from the acute discomfort. Key symptoms: sudden intense tooth pain, tenderness, and sensitivity to tooth in the affected area, aggravation from pressure on jarring, relief from cool application, or laying down. Plantigo toothache with sensitivity. Plantigo is a primary remedy for toothache with sensitivity to touch and cold. It provides relief from pain extending to the ears from the teeth, offering a numbing effect to alleviate the discomfort. The symptoms: toothache with sensitivity, touch and cold, swelling or cheeks occupying, relief from pressure on the affected area, pain extending from teeth to ears. Staphylococcus aureus addressing toothache with tenderness. Staphylococcus aureus is the managing toothache with prominent tenderness. To touch, it helps alleviate oral discomfort caused by cold drinks or cold air, offering relief from the painful symptoms. Key symptoms: toothache with tenderness to touch, pain aggravated by cold drinks or cold air, not risen by beating down on the affected tooth, indicated for toothache during menses or pregnancy. Naxomica alternating irritable tooth pain. Naxomica is a well-known remedy for toothache characterized by irritability or rosen by cold air. It addresses burning, stinging, or shooting pain in the teeth, providing relief from the occupying sensitivity. Key symptoms: toothache rosen by cold air, burning, stinging, or shooting pain in the teeth, and sensitivity to touch, pain radiating into the jaw, face, and temples. Next remedy is Calendula, promoting healing and infection control. Calendula is instructional, is promoting healing and controlling infection in dental problem. It helps overcomes inflammation and infection and abscesses, providing from pain and adding in the infections. So that is all what I have. So if anyone have a question about this topic, so I'm here to answer. So I want to say thanks to everyone who attend this Zoom meeting. So next Sunday, same time, we meet again here with new topic. And God bless you all. Goodbye.